Specimen transportation. So there's guidelines for specimen transportation and time restraints, okay? So the quality of results, so the most accurate results is going to depend on the time between the specimen, when the specimen is drawn and when it is analyzed. The longer the time, the more likely the results will be inaccurate, all right? So a general rule is regular requisitions, all right? So they don't have they don't need to be immediately analyzed, and results don't need to be immediately given. So that's what a regular requisition is. Should be delivered within 45 minutes of the blood being drawn. The general rule for stat requisitions are deliver immediately after being drawn. Now, the CLSI, the Clinical Laboratory Standard Institute, says no more than 2 hours should pass. That's a maximum, okay? So the general rule, once again, regular requisitions, 45 minutes being delivered. Stat should be immediately. The CLSI, once again, says no more than 2 hours should pass. So important things to note when you're thinking about when transporting the specimen to the lab for to be analyzed. So it's when it comes to temperature considerations. Temperature extremes can cause hemolysis, which is when we break down when the breakdown of red blood cells occur. Keeping samples do not require heating or cooling at room temperature is very important. There's some samples that might need to be heated, that might need to keep at a cool temperature. If they do not, room temperature is the best temperature for them. Tubes that contain specimens that must be kept at 37 degrees Celsius should be warmed using a heel warmer packet before collection and then transported in a heel warmer packet. So once again, tubes that require specimens that must be kept at 37 degrees Celsius should be warmed using a heel warmer before collection and then during transport. Some tests require warming of the specimen in a 37 degrees Celsius incubator before testing as well. Phlebotomists should warn lab staff of incoming warm samples. So something that they should know about ahead of time. Now, if it needs to be cold, then these are things such as blood gases and lactic acids that should be chilled. So a chilled sample should be placed in a slurry of chipped or shaved ice and water. What this does is it promotes complete contact between the sample and the ice bath. So for specimens that need protection from light, what can happen is that exposure to light can break down the light-sensitive analytes, all right? So these light-sensitive analytes can be things like bilirubin, vitamin B, carotene, folate, things of that nature. So to prevent exposure, what we're going to do is we're going to collect the sample in an amber-colored tube and wrap it in aluminum foil, or we're going to place it in a brown envelope or a heavy paper bag. And what that will do is prevent that exposure of light from happening and from breaking down that light sensitivity. When we're transporting samples to the lab, all right, it can be hand carried by the phlebotomist. It can be dropped off at a designated area in the hospital for transport. A lot of larger hospitals tend to have a transportation department that is responsible for delivering that sample. So it all depends about where you work, the facility you work in, and the method that they use. So make sure you're always following your facility's policies. Some use a tube system. So if you ever been in the bank, the little tube system, you put your information in, it goes into the bank, then they send it back out. Some pharmacies use that same tube system, so that's what they're talking about, the tube system. And then some may arrive from outside clinics and doctor's office as well by couriers. That's very, very common, that doctor's offices and outside labs use couriers to pick up and transport their lab samples. So, as far as safety with sample processing, OSHA requires PPE to be worn during sample processing, okay? So those that are processing the sample in the lab must wear PPE. This is going to include gloves, full-length lab coat or gown that is buttoned or snapped with closed cuffs, protective face gear, including goggles and mask or a chin-length face shield. So all of that must be worn when processing a sample for safety. When it comes to clotting, Serum specimens must be completely clotted, all right? So clotting can take anywhere from 30 to 45 minutes. Samples from patients on anticoagulants have longer clotting times, as do chilled specimens. So that's something just to keep in mind. When it comes to the centrifuge, what that is it spins the sample at a very, so what we do is we have a centrifuge, and you'll see a picture of this. And what it does is we put the vacutainer tubes in the centrifuge, and it spins it at a very high speed. And what it does is it separates the components based on density. So the most important principle of the centrifuge operation is that every sample must be balanced by another or equal weight, okay? The lid must be closed and locked during operation and must be remain closed until the centrifuge comes to a stop, all right? That's really important. So removing a stopper, all right, so pulling the stopper, the top off the tube. Obviously, there's a major risk for formation of aerosol, microscopic mist of blood that forms. So what that aerosol is, that microscopic mist of blood that forms from droplets inside the tube. To remove, what we're going to do is we're going to place a 4x4 gauze over the top and pull the stopper straight up, twisting if necessary, okay? So a 4x4 gauze over the top of the stopper and pull straight up, twisting if we need to. We do not want to rock side to side to pop it off, and we're going to make sure we use a face safety shield, because if that blood comes up and spatters, we do not want to get that in our mouth, our nose, our eyes, or any opening into the body, right? That's where that infection can spread, all right? So once again, this is how we remove the top of the tube, all right, when we're doing that sample processing in the lab.